Now let's look at the symptoms associated with diseases of secondary hemostasis. Secondary hemostasis, as we know, is responsible for strengthening the already formed clot. The fibrin that is laid over the platelet plug strengthens it and prevents its degradation. Thus, disorders of secondary hemostasis lead to a decrease in the production of fibrin, and the platelet plug becomes susceptible to degradation over time. With breakdown of the platelet plug comes delayed bleeding. So delayed bleeding is a key symptom of secondary hemostasis. This is bleeding that develops after the wound has initially healed. Another characteristic of disorders of secondary hemostasis is the bleeding type tends to be different. In contrast to disorders of primary hemostasis, disorders of secondary hemostasis tend to cause deep tissue bleeding. This includes bleeding into muscles in the form of intramuscular hematomas and into joints in the form of what's referred to as a hemarthrosis. That's bleeding into the joint. Intramuscular hematomas tend to present with large, purplish-red, non-blanching lesions that are much larger than the typical ecchymosis and confined to one muscle area. One way this can be distinguished from a purpura or ecchymosis is that the blood collecting in a confined space will increase the pressure in that space, which may lead to pain. Purpura are generally not painful. And then hemarthrosis presents with swollen, painful, and sometimes red joint. Recurrent episodes of hemarthrosis can lead to long-term disfigurement and limited mobility of the joint. This is referred to as hemophilic arthropathy. And unfortunately, just as with disorders of primary hemostasis, disorders of secondary hemostasis can lead to intracranial hemorrhage as well. The final comment I want to make in this section is that while disorders of primary hemostasis do have a tendency to lead to early bleeding and mucocutaneous bleeding, and disorders of secondary hemostasis lead to late bleeding and deep tissue bleeding, there is a lot of overlap in the clinical symptoms between these disorders. So it is possible and likely that you'll see patients with disorders of secondary hemostasis who have easy bruising or gingival bleeding or other signs of mucocutaneous bleeding. So don't be surprised if you see some clinical overlap. But do know that these clinical symptoms can help point you in the direction of a disorder of primary or secondary hemostasis.